Hello, my name is Marc Laniado. I'm a consultant urologist and I have been a consultant in London since 2002. I'm going to talk about benign prostatic hyperplasia, also known as BPH, or an enlarged prostate. Now, prostate enlargement is very common as men get older. Almost all men will have it. It's difficult to avoid. What can we do about it and what does it do to us? Well, men with an enlarged prostate often develop urinary symptoms such as having to get up at night or pass urine more slowly during the day, sometimes more frequently and occasionally more urgently. It becomes progressively worse and is exacerbated by caffeine, alcohol, things of that nature. At some point it becomes more debilitating and treatments are needed. Initially medications such as tamsulosin or alfuzosin are tried. These may work, but sometimes not for long enough. Other drugs can shrink the prostate, but not effectively treat the symptoms quite so much maybe, but also have side effects. Now, there are other options for the enlarged prostate. These are surgical or procedural in nature. A new treatment known as Aquablation has recently become available. So Aquablation involves using a high-speed water jet. Now to do it, we put an ultrasound probe in the back passage to scan the prostate and create a 3D image of the prostate gland. We also look with a cystoscope to see inside the prostate area. Then using a computer system, we outline the prostate and then the treatment area, that is the area that we want to blow away with the high-speed water jet. Then to do this, a robot delivers the jet very accurately using the computer technology to ensure that only the outlined area is removed and the rest of the prostate is preserved. By removing the prostate tissue, the urinary flow is much faster and urinary symptoms get better over time. One of the advantages of Aquablation over standard treatments of the prostate is that about 7 in 10 men or 8 in 10 men who have the procedure can keep a wet ejaculation, whereas 2 or 3 out of 10 men may not. Now you may wonder why this may be an advantage. Well, the other treatments for benign prostate enlargement or BPH, such as TURP or HoLEP, usually result in having a dry orgasm in almost all the patients who have it. So Aquablation represents a significant advance in our ability to remove large prostates, yet hopefully preserve ejaculation in many of the patients who have it. An alternative treatment for the enlarged prostate is HoLEP, Holmium Laser Enucleation of the prostate. This uses a laser to remove the inner part of the prostate, which is often overgrown and obstructs the flow of urine. Now, HoLEPs are particularly useful for men who have very large prostates or for men whose bladders do not contract weakly. The reason HoLEP is very beneficial in this case is because the whole of the inner part of the prostate is removed rather than part of it. And this means that even weak bladders can contract better in this situation and more effectively push urine out, but also it means that any size of prostate can be treated with a HoLEP, whereas the other technologies are limited in many ways by size and other factors. HoLEP is a technology that can be applied to all sizes of prostates, whether stones are present and with other anatomical variations as well. Multiple new lasers have been developed to use for HoLEP. HoLEP Moses 2.0 is a new technology that enables more effective removal of the prostate yet reduces bleeding from the prostate gland. There are also other techniques to ensure bladder control is well preserved. So all in all, the outlook for men with the enlarged prostate is quite good. We have new procedures like Aquablation that can remove very large prostates, yet in many cases preserve ejaculation, although not always. And we also have HoLEP with new lasers and more advanced techniques to remove even very, very big prostates with minimal bleeding and good outcomes. So the future is good for men with enlarged prostates. I've been doing these procedures for many, many years, and I can thoroughly endorse them as good techniques for men with BPH.